The day was hot, sweltering actually. The sun beat down on my head, and no matter where I stood, I couldn't escape it. But I was distracted by an entrance to our exam tent. Two middle-aged men were carrying an older man around on what looked like a plastic chair, taking him from station to station. The man had a huge cleft lip. His face was weary and weathered. His eyes were deep, kind. They looked as if they'd seen the world, as if they'd known suffering. Jose is 63 years old, and he suffered from his cleft lip his entire life. He never married. He never had children. He never even once saw a doctor. But his nephews heard about our mission with Operation Smile in Lima, Peru, and brought him to us, hopeful that maybe there was something we could do. Every 3 minutes, somewhere in the world, a child is born with a cleft. There are cleft lips, cleft palates, and some babies are born with both. A cleft simply means an opening where there shouldn't be one. A cleft lip is an opening from the top part of your lip that extends up to the septum of your nose. In some babies and children, it's so big that the gums are exposed and the teeth can stick out. A cleft palate is a hole in the roof of your mouth. This enables a direct communication between your mouth and your nasal cavity. Cleft palates affect eating, drinking, and speech. Children with cleft palates don't sound the same way you or I do. When they talk, they sound very nasally, and they're often difficult to understand. When they drink liquids, it can seep out their nose. Imagine, you're a teenage girl out with your friends, you take a drink of soda, and it just comes out your nose. Babies have trouble breastfeeding, and some can't even suck from a bottle. This makes it really hard for them to get the vital nutrients they need to grow and survive. They often end up malnourished, and some will die of starvation. What causes the cleft? Well, there are several factors, but we know for sure that exposure to toxic chemicals like pesticides, genetics, and malnutrition during pregnancy, vitamin deficiencies, these are all contributing factors. If you think about it, a woman who's pregnant, who's working in a field all day, surrounded by pesticides, doesn't earn enough income to eat the diet she needs for her growing fetus, is at a disproportionate risk for having a baby born with a cleft. Does it happen in the US? It does, but we don't see it as often because babies in the US are repaired long before their first birthday. They don't have to suffer the same social stigma or debilitating speech impediments because they get a surgery before they can talk. This, however, was not the case for Jose. Jose suffered from his cleft lip for 63 years, his entire life. As a poor farmer in a rural area in the outskirts of Lima, Peru, Jose didn't have access to medical care. He didn't have access to a surgeon. But he was so embarrassed by his cleft lip. He told us that at one point, he had tried to sew his lip together on his own. When that didn't work, he would glue tree bark to the hole above his lip and hope people would think it was a mustache. It was a desperate attempt to fit in. But thanks to Operation Smile, Jose received his surgery. And in 45 minutes, his life was changed. In 45 minutes, a condition he had suffered with for 63 years was gone. Jose smiled for the first time in his life, and his smile lit up the room. He took my hands and pressed them to his chest in a gesture of gratitude. He was grinning a big, toothless grin. He was beaming, and I was so humbled. Stories like Jose's are a large part of my story now. That's because my life was forever transformed the day I decided to volunteer as a nurse. Right out of nursing school, I was working in a high-acuity pediatric intensive care unit. My shifts consisted of long hours at the bedsides of children who were so sick They needed multiple continuous medications and machines just to keep them alive. If I missed one medication or there was one mechanical error, they may not survive. It was terrifying. But working so intimately with life and death was a constant reminder of the brevity of life, and it compelled me to live my life with a sense of purpose. Volunteer nursing has taken me all over the world and allowed me to connect with humanity all across the globe. I've recovered children from heart surgery in Ulaanbaatar. I traveled around Mongolia in an old Russian school bus, setting up makeshift clinics throughout the Gobi Desert. And with Operation Smile, the nonprofit who helped Jose, I've been to several countries in Central America, South America, Africa, Asia, and Eastern Europe, all with the mission to repair facial deformities. And it's in these moments that I'm at my happiest. Despite the grueling pace, the long hours, frustrating infrastructure, and often lack of resources, I love every minute of it. It feels like medicine in its purest form. And when I think about what pushes me out of my comfort zone, what compels me to do something so crazy, it's really an answer to the question, how can I help? How can I make a maximum impact on the suffering around me? And I think it's a question that a lot of nurses ask themselves. It's what drives us to the nursing profession. We want to be able to use our minds, our hands, our skills to improve the quality of life for those around us. I want to tell you the story of Clara. Clara was born with a severe bilateral cleft lip and cleft palate. Her mother was afraid to breastfeed her. In fact, she wouldn't even call Clara her own daughter. And in their tiny village in the highlands of Madagascar, their neighbors would gossip and whisper about Clara and her family. After 2 years, the emotional burden of Clara's facial deformity was too much for her mother, and she walked out on them, leaving her family behind. But the day she left, Clara's father made a promise. He promised that he would find a solution for his daughter, find a way that she could live a life of love and acceptance, and not the fear and isolation and shame that she experienced every single day. It would take him 6 years to fulfill that promise. But Clara's father took her to a clinic where he first saw a poster by Operation Smile offering free surgeries. To get to the clinic, they had to walk over 2 hours, barefoot, through rice paddies, across rivers, over steep hills. And along the way, children would follow Clara to stare at her and the gaps in her lips. And although she was accustomed to being treated as an outcast, it still hurts. Clara was teased by other children at school. She hated going outside, and she would beg her father not to send her to classes. But Operation Smile sent a bus to bring Clara and her father to their mission site in Anstrabi. And there, Clara received her life-transforming surgery. Now Clara holds her head up with a newfound sense of confidence. She's not afraid to go outside or look other children in the eye. She goes to school. I told you 2 stories, 2 very different stories, the story of Clara and the story of Jose. And although they're very different, there's something really similar. Both were missing from the world. Both were on the outside looking in. And all it took was one surgery. A surgery made possible by companies who stopped to ask, how can we help? By individuals, by nurses and doctors who stopped to ask, how can I help? And now Clara and Jose, they're back on the inside where they belong. That is how we alleviate suffering. That is how you use your gifts to make the greatest impact on humanity. It was in a mission in the Gobi Desert that I realized my next calling. I was traveling with a group and we were screening children for congenital heart disease. We were setting up makeshift clinics and we didn't have access to electricity. So we could only see patients for as long as we had daylight. As a nurse, my role was the triage. I was outside the clinic taking basic complaints and doing vital signs. And I looked up and saw this discouragingly long line. A line of people who had traveled for hours, some for days, some on foot, some on camel, some on horseback, all to be seen by our medical provider. And I realized I needed to do more. Our medical providers were so backed up, there's no way they were going to make it through this line before the sun fell. And these weary mothers and fathers who had sacrificed so much would go home without being seen. But if I was a nurse practitioner, I could help do the exams. I could help give them the diagnoses and the medical treatments they needed to have a better life. And so that day, I decided I had to go back to school. And so I did. I went back to school to become a nurse practitioner. And it was during my time in graduate school at the University of California, San Francisco, that I started taking courses in global health. It was actually the first time I'd stopped to look at the impact my volunteering had on the world around me. Like so many other well-intentioned volunteers, I used to hop on a plane, go to some foreign country, practice medicine, come home with lots of photos and great stories, and overall a sense that I was doing something good. But these courses rocked my world. I realized that global health is not about bringing the world what we think it needs, but by asking the world what it needs and then committing to meet that need in a sustainable way. And that is what I love about Operation Smile. They've adapted their model to provide compassionate, sustainable care. By partnering with local governments and nonprofits and medical professionals, they've maximized the number of children they serve, and they provide the highest quality post-operative care. Now when I go on these missions, I actually go as a teacher and a mentor. I get to train nurses who work and live in the communities we serve. I get to help empower and educate these highly motivated nurses to alleviate suffering in their own countries, in their own communities. And in return, they completely invigorate my perspective on nursing by giving me a vantage point that's so different from my own. The best part is, you can hop on a plane and do 100 surgeries, or you can hop on a plane and train a group of medical professionals and watch as they treat thousands of patients long after your flight has left. That is maximum impact. I think the best story to illustrate this is the story of Doreen Love. And let me tell you, Doreen Love lives up to her name. I first met Doreen Love on an Operation Smile educational mission in Ghana, West Africa. The purpose of the mission was to educate and train a group of surgeons, pediatricians, nurses, anesthesiologists, speech pathologists, and child life specialists so that they could carry out their own surgical missions in Ghana. I was assigned a group of 5 lively recovery room nurses. And although they were a little timid and shy when recovering our first few patients, their passion and commitment was palpable. These women had all taken time off work without pay to help the children of Ghana. They were committed to alleviating suffering in their own communities. Doreen Love stood out. She was a natural leader. She just didn't know it yet. She volunteered on every single mission she could. She traveled hundreds of miles. She spent long weekends away from her family, and she read every piece of material on cleft care she could get her hands on. Yet despite her passion, she doubted her abilities. She didn't think she was smart enough or knew enough to be a leader. And when I asked her if she was interested in stepping into that role, she actually laughed at me and said there was no way she could do that. But over the week that followed, I had the privilege of working alongside her and helping train and mentor her. And I watched as little by little her confidence grew. Soon, she began to volunteer to step forward and recover patients on her own. And on the last day of the mission, I walked into our recovery room to find Doreen Love leaned up against the whiteboard, teaching the nurses a lecture I had taught her just a few days before. A leader was born. Now Doreen Love leads the surgical missions in Ghana. She is the nurse leader responsible for coordinating all the patient's care during surgery. She is truly an inspiration, and her impact will reach thousands of children in Ghana. That is how nurses are changing the world, by asking, how can I help? How can I alleviate the suffering around me? And you guys, you don't have to hop on a plane to do this. You get a chance every single day, no matter where you clock in. But if you feel compelled to go where you are needed, instead of all the reasons why you can't or you shouldn't go, and there will be a lot, go. Take that leap of faith. You won't regret it. You'll find yourself recharged in a way that you never thought was possible. As nurses, we are seen as caretakers, sitting by a bedside and holding someone's hand, comforting them through their most difficult moments. And yes, that's a large part of what we do. But we are more than caretakers. We are keepers of a universal language, a language that supersedes all borders, all boundaries, all politics, all culture, and all class. We are translators of ideas, of skills, of knowledge, of training. We live and work in that space in between, in those gaps no one else sees. And that gives us an incredible amount of insight and opportunity to change the world like no other group of people can. Nursing requires you to be vulnerable, to be uncomfortable, to stay present with people during the hardest moments. Yet I believe that the way we show up in the world, our belief in the very real human connection that links us all together, is an endless source of courage that will help us make the world a better place wherever we go. I hope that I'm a living testament to you, that if you choose to share your gifts with the world, you will see just how much the world needs you, and in return, how much you need them right back. Thank you.